WFYI podcasts are made possible by Bloomington, Indiana, an American college town offering experiences like indulging in grub at Nick's English Hut, taking a stroll along Kirkwood Avenue, feeling the history and magic of Assembly Hall, and providing the chance to feel like a college kid again. Plan your trip at visitbloomington.com.
I'm Kyle Long, host of Cultural Manifesto, just one of the local music programs you can enjoy on WFYI. These programs would not be possible without your financial support. And to say thank you, we want to send you to see Lyle Lovett when he comes to Indianapolis on July 28th. Choose a concert ticket as your gift when you donate at WFYI.org/give. And thanks for supporting WFYI.
This is WFYI News Now. It's June 6th, and I'm Abriana Herron. On today's show, how an early childhood coalition plans to address the lack of affordable childcare. Research shows food insecurity got worse in 2023. And bird flu virus has made its way to dairy cows and infected a few farm workers. Public health experts say the response may be hampered by misaligned priorities.
Because we have very different points of view in terms of what is critical right now. But if one day this virus were to change sufficiently, it could kill lots of people. So now I have a real concern about what's going on your farm.
Those stories coming up. But first, Rufus Parnell Jones, the 1963 Indianapolis 500 winner, died Tuesday at Torrance Memorial Medical Center after a battle with Parkinson's disease, his son said. Drew Daudelin has more.
Parnelli Jones, as he was known, was 90 years old. At the time of his death, he was the oldest living winner of the Indy 500. Jones was born in Texarkana, Arkansas in 1933, but moved to Torrance as a young child and never left. It was there that he became Parnelli, because his given name of Rufus was too well known for him to compete without locals knowing he wasn't old enough to race. In 1962, Jones became the first driver at Indianapolis Motor Speedway to qualify at over 150 miles per hour. He was the Indy 500 pole sitter in 1962 and 1963, and co-rookie of the year with Bobby Marshman in 1961. Jones is survived by his wife of nearly 57 years, Judy, sons PJ and Paige, and 6 grandchildren. Both of Jones's sons had professional racing careers. I'm Drew Daudelin.
For every 100 job openings in Indiana, there are only 72 workers available to fill those roles. That's according to the U.S. Chamber of Commerce. Experts say one possible reason is the lack of affordable and accessible childcare. Indiana Public Broadcasting's Tamoria Cunningham reports how an early childhood coalition plans to help solve this issue.
Allie Sutherland directs the Northeast Indiana Early Childhood Coalition. She says a $5 million grant will fund the launch of the new TriShare Plus program. The program will help working families across 11 counties pay for child care, splitting costs evenly between the grant, the family, and the employer.
So what we're hopeful is that by lowering the cost of care, that allows more families to get back into the workforce, which then really helps them in their families.
Sutherland says the program will also provide administrative support, training, and other resources for child care centers in Northeast Indiana. Sutherland says she hopes the new program will start in September. For Indiana Public Broadcasting, I'm Tamoria Cunningham.
Food insecurity increased for the second straight year in 2023, according to researchers from the Urban Institute, a D.C.-based social policy think tank. That affected families who relied on the Federal Supplemental Nutrition Assistance Program, or SNAP. The new analysis, performed by the Urban Institute, found that SNAP benefits did not cover the cost of a moderately priced meal in 98% of U.S. counties. That's despite an annual cost of living increase from the U.S. Department of Agriculture to the SNAP program. The analysis found that benefits fell roughly $50 short of monthly food expenses by the end of 2023. Researchers behind the analysis say with the U.S. Farm Bill, which oversees SNAP benefits up for reauthorization, any cuts to the program could be, quote, devastating for families with low incomes. Republicans in the U.S. House have proposed cuts to the SNAP program. And for our final story today, Bird flu has been found in dairy cows for the first time across 9 states, some in the Midwest. Health experts worry that the virus's new proximity to humans increases the chance it would turn into a human virus. We're clearly not there yet, and the risk remains low. But Side Effects Public Media's Ben Thorpe reports health experts in the agricultural industry may not be on the same page about the urgency of responding to the virus.
Around 150 cows graze idly at Purdue University Dairy's big open barn in Indiana. Visitors have to put on blue booties to cover their feet. It's one typical measure to keep diseases from leaving the dairy on a visitor's shoe. But what is new is a sign-in sheet at the dairy's entrance, which includes a column titled Date of Last Contact with Cattle.
This would give us an ability to track that a little bit. That's right.
Thomas Cully manages Purdue's dairy unit. He says the farm has also placed owl scarecrows and noise cannons to scare off birds potentially infected with the bird flu, or H5N1.
Yeah, the big unknown is how long will this last, and will it die out after this year and it's history after that for a generation, or will this be back every year? Is this going to be our seasonal flu that we have every year now? I don't know.
Across the country, health experts and policymakers have been scrambling to respond to the virus, exploring everything from additional PPE for dairy workers to the beginnings of vaccine development. This year, there have been 3 cases of bird flu in humans. The first 2 in dairy workers showed up as pink eye or conjunctivitis. But the 3rd case in Michigan was different. It included respiratory symptoms. Scientists say that increases their concern.
I think if we're going to have a pandemic of H5 in humans, it's unlikely to be a conjunctivitis pandemic. It's going to be respiratory.
This is Richard Webby. He's a virologist at St. Jude's Children's Research Hospital in Tennessee. He says a respiratory virus could spread more easily from human to human.
Every time we give this virus more opportunities to change, and by that I mean give it more opportunities to replicate in more people or replicate in more different types of animals, it does change it. But right now the risk to human health is still low.
Some experts suspect there are more cases, both human and cow, that aren't being caught. The problem is that some states are not looking for the virus, experts say. In Indiana, agricultural officials say they won't start monitoring dairy workers for bird flu until the first cow infection is confirmed in the state. Denise Darrow-Spears is with the Indiana State Board of Animal Health. She says if cow infections are confirmed in the state, it could mean a financial hit.
It turns into extra limitations or resistance to buy products that originated in Indiana just because one farm was found here, but we have 698 others. So it could be an economic disadvantage to producers if we find it in the state.
Spears also says that there is a concern that farmers may not want to self-report cases on their farms.
We're trying to communicate with them as much as we can and really be partners to them to assure them that we're going to work through this and get them to everything is fine as fast as we can.
Federal officials recently announced subsidies for farmers who lose milk due to the bird flu. It's one of several steps the feds are taking to help track the virus. But the different incentives are what worry Dr. Michael Osterholm. He's the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He says, on the one hand, farms don't want to lose business or be looked at as getting people sick. But on the other hand, unchecked, the virus could pose an unprecedented risk to human health.
We have very different points of view in terms of what is critical right now. So none of these are, in a sense, the wrong perspective to have. But if one day this virus were to change sufficiently, it could kill lots of people. So now I have a real concern about what's going on in your farm.
For now, the Centers for Disease Control and Prevention says the risk to humans from the virus remains low. But the department asks states to ramp up their influenza surveillance over the summer to keep an eye out for the virus and how it's behaving. Ben Thorpe, Side Effects Public Media.
Side Effects Public Media is a health reporting collaboration of NPR member stations across the Midwest. That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Drew Daudelin, Kendall Antron, who composed the music for this podcast, and me, Abriana Herron. Our news director is Sarah Neal-Estes. If you like today's episode, remember to subscribe and share. And follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.
WFYI podcasts are made possible by Bloomington, Indiana, an American college town offering experiences like indulging in grub at Nick's English Hut, taking a stroll along Kirkwood Avenue, feeling the history and magic of Assembly Hall, and providing the chance to feel like a college kid again. Plan your trip at visitbloomington.com.